Hello, hello. How is everyone doing? Today we are going to talk about some exercises that work on the sacroiliac joint. I posted a picture in the Facebook group about this presentation today with an image of it so you guys can kind of have a visualization of where that joint is connecting the pelvis with the spine. So I'm going to tell you a quick story. First of all, everyone here in our Facebook group watching live, type live, say hello, let me know you're here. If you're watching on the replay, type in replay so we know you are here. If you're watching this on Facebook and you want to join our live videos in the future, you can click on the link in the description that talks about our Facebook group and you can join us for these live presentations. So I'm going to tell you a quick story. I was actually in Disneyland a couple weeks ago and I was sitting at the breakfast table at the hotel about ready to go to the park for our first day. And I was sitting in my chair. My daughter was in the stroller to the side here and I turned and I picked her up and something tweaked in my back. And I'll tell you, it hurt so bad. I couldn't do anything with her, right? She was just hovering here. My mom came and grabbed her, and it took me about 45 minutes to be able to sit up into a sitting position because I tweaked something, and it was irritating my sciatic nerve, and it was not cooperating with me. So I'm just here to say that if you've felt that before, I feel it, and that's what led me to looking into, okay, what is this? What's going on? What stretches can I do to help prevent this from happening in the future? What exercises can I do to strengthen my back and my hips to help prevent this from happening in the future? So we're going to talk about it a little bit today because why not share what I learned with everybody, right? So disclaimer, these exercises and stretches are not for everyone. Only do what you feel physically comfortable with doing. Talk to a healthcare professional if you have questions about them. I'm just going to show you some stretches and exercises that work for many people to help relieve the pain in this area. I'm going to do them on the floor here. If you have a hard time getting on and off the floor, you could also potentially do some of them in the bed, on the bed, so that you don't have to get all the way down on the floor. But again, some of these deal with balance, some of these deal with different positioning. So if it's not right for you, please don't try these exercises. If it is for you and you feel comfortable and you feel safe and confident, then go ahead and try them or talk to your doctor or other healthcare professional before trying these exercises. So just to chat a little bit, we're going to chat about the exercises that help stabilize these joints, the sacroiliac joints. They're on both sides, right, where our hips connect to our spine. And by stabilizing these can help prevent painful motions that irritate that sciatic nerve, kind of what probably happened to me. And then we're also going to do some stretches that reduce the tension around these joints and can restore our range of motion. And this will help relieve muscle tension that might be bugging that sciatic nerve also. The sciatic joint itself has a very small range of motion. It doesn't move a lot. It's not like our elbow or our shoulder, but too much or too little movement or the joint becoming inflamed can irritate that sciatic nerve that runs right by that joint. So I'm going to show you some stretches first that we can do to help relieve pain if you're having sciatic nerve pain due to irritations at the SI joint, the sacroiliac joint. So first I'm going to do a single knee to the chest, which targets that joint. So I'm just going to go ahead and I'm going to move this real quick. Okay, so we're just going to lay down on our back. And your feet can be down or kind of up, but we're just going to take one leg, grab behind that knee, and pull the knee towards our chest. And you can hold this for however long is comfortable, a few seconds, and then release. And of course, we can do it on both sides because we have the SI joint on each side. You may have pain on one side and not the other. My pain has always been on my right side, so that's the one that bugs me. Another way to do a similar stretch is to cross your knee over your other knee And then do the same thing. Bring your hands behind that back knee and pull it up. So it kind of brings the other side across your body a bit and just stretches it in a little bit of a different way. So again, our legs are down, cross one leg over the other leg, and then put your hands behind this knee. If you can't reach all the way to this knee, you can grab a strap and kind of put a strap around it and hold it to help pull it up if that helps you. So another stretch that we can do is a press up into extension. So I'm just gonna face you guys here for this one. And this is a good stretch for sciatica pain. So basically, I'll back up a little bit. We start here, laying flat on our stomach, and we're just going to come up onto our elbows. And this itself is a big stretch for some people, especially if that sciatic nerve is really bugging you. So try to hold it maybe 5 seconds, aim for 10 seconds, aim for 10 repetitions. So you kind of come down, let it relax, and then come back up. If this isn't too much of a stretch for you and you want to go a little more, when you're down here, you can put your hands by your chest, and we're going to just push up to raise up a little bit more, and you can go as high or as low as what's comfortable for you. But we want to make sure that your lower back isn't tensing up as you're doing it. You're relaxing your pelvis, relaxing your lower back, letting that just stretch by holding yourself up in this position. And then we come back down. So again, start small and increase, do a few repetitions of that. The last stretch we're going to do, and then we'll do a couple exercises, is lumbar rotation. So I'm going to come back around to my back again and lay here with your knees up, and my hands are just down by my side, and we're just going to gently rotate and move our knees side to side. Our knees don't move too much. Our thighs will kind of rub together. We want to make sure that our pelvis and our back is staying flat on the ground. We're not coming over so far that we're twisting, right? We're keeping that stable and in place. Just letting our knees kind of slide to the side. I'll turn this way so you can kind of see how they go. Just a little bit side to side. And you can go to one side and hold it for a few seconds, and then the other side and hold it for a few seconds. You can do it back and forth for 30 seconds and then rest. Whatever works well for you. So one thing to say about these stretches are, if we stretch sporadically every now and then, it'll feel good when we're doing it. Might hurt when we're doing it, but it could feel good when we're doing it, but it's not really going to help us in the long run with relaxing that joint and really preventing this pain from coming back. We really need to be in a consistent cycle of doing these stretches every day, maybe twice a day, if we want to help prevent pain in this area and help prevent this joint from becoming disturbed. So just throwing that out there. We should start a stretching group. I know I need to stretch more. So now I'm going to show you just a couple of exercises that help strengthen the pelvic muscles, that stabilizes the SI joint and reduces excess motion that aggravates that sciatic nerve. So there's 2 of these we're going to do. Again, try them out. If they seem right for you, ask your healthcare professional if you're not so sure. So the first one is a bridge. So we'll go on our back again and have our knees bent. And then we're going to push down on our feet to lift our hips up. And then we just come back down. And you want to make sure that we are going up in a way that kind of keeps our body straight, a straight line from our knee to our shoulders. We don't want to go higher at our stomach or slouch down or anything like that. We want to try to just lift up at the hips till we have that straight line there and come back down. I would try for about 10 repetitions of these. And then you can rest and do some more later. Start small. And then increase to going big later. So those are bridges. Now this last one is called a bird dog pose. I don't really know why. but it does challenge your balance. I was practicing earlier and almost fell on my face. So if your balance isn't so great, maybe don't do this one on your own. If you are interested in getting help with your exercises, reach out to me, let me know, and I can help guide you towards what you need for that. But we're going to get on all fours here. And our hands are under our shoulders, our knees are under our hips. And then we're going to raise up one arm and the opposite leg. And just hold it straight out like this for however long you can. 1 second if you can, 3 seconds if you can, 5 seconds if you can. And then we're going to switch. Lift that leg up, reach this arm up. Try to keep your body straight as you're doing this. Again, it does challenge your balance. I'll turn this way just so you can see another angle. So I'm lifting up here my right arm and my left leg. So you can see how it would be easy to tip forward or back if we are not stabilized with this. And this just helps strengthen those muscles around that SI joint. That will help your hips and your back stay strong. So I hope that was helpful. Again, if you have any questions, as always, feel free to reach out and let me know. And if just talk to a healthcare professional that causes discomfort and how it can cause that pain going through your sciatic nerve into your buttock and down your leg and your lower back, and some exercises to help relieve that if that's something that you need. So have a great one, and I'll talk to you guys next week.